Welcome to the Canadian Massage Conference pre-conference broadcast series on Massage Therapy Radio. I'm Felicia Brown, and I'll be your host for this interview and series. This is one of several broadcasts with the presenters and experts who are appearing at the Canadian Massage Conference and brought to you by the One Concept Group, November 4th through 6th, 2011 in Burlington, Ontario. I'd like to take this opportunity to thank the 2011 Canadian Massage Conference sponsors, the Vitality Depot, Lackner McClelland Insurance, Massage Therapy Canada Magazine, Biotone, Massage Warehouse, the Registered Massage Therapist Association of Ontario, and Hand and Stone for making this year's event possible. Our special guest today is David Kent. David and I will be talking about his 3-hour class at the Canadian Massage Conference, Headaches, Triggers, and Treatments. But before we get started, let me tell you a little about David. David Kent is the president and founder of Kent Health Systems that teaches full body dissection seminars to massage therapists and acupuncture physicians at the University of South Florida College of Medicine. He also teaches deep tissue medical massage and practice building seminars and has developed a line of products, including the postural analysis grid chart, trigger point charts, personalized essential office forms, muscle movement chart, and a series of DVD programs. David has a monthly column in Massage Today called Keeping It Simple that provides treatment and practice building tips. He is also a regular contributor for Massage Magazine and other leading trade journals on topics from dissection, posture analysis, and trigger points. David, welcome to the Canadian Massage Conference pre-conference broadcast series. As always, it's great to talk with you today. I'm excited to learn more about your class, Headaches, Triggers, and Treatments.
Thank you, Felicia. I'm excited to be here and part of the Canadian Massage Conference in the pre-conference broadcast series. I hope all our listeners today are going to be able to attend that conference. They can not only learn more at your website, but also at kenthealth.com. I want them to know I have more information about the Canadian Massage Conference. So I hope you can be there and join us.
Well, we're really glad to have you today and at the conference again this year. Before we get into your topic, I'd like to ask you, you're obviously excited and enthusiastic about being there, but why exactly did you want to be involved with the Canadian Massage Conference?
Multiple reasons, Felicia. First off, it's the team. It's a phenomenal team that organized the event. I've worked with, like Scott, for example, we go back to the early 90s. He had sponsored a seminar bringing me up into Burlington. They're all therapists. They understand our educational needs. I get to work with professionals like yourself who, make it fun. And it's a rock-solid team. They've got a proven track record. They know what they're doing, and they do it well. And that's why I am glad to be on board.
Well, we're glad to have you, and thanks from all of us for the flattering compliments. We're glad to be part of the enticement to bring you there. Certainly myself, anyway. You can flattery will get you anywhere with me. But what I'm curious, in terms of the conference, what events and activities are you most looking forward to being a part of at the conference?
There again, it's multiple things. Therapists, I love being a massage therapist, and I love being around massage therapists. I learn so much when I get to hang out with my peers and communicate with them and collaborate and talk. It's one of the few times you and I get to visit is at one of these events, face to face. The classes, there's going to be such a variety of speakers there again that we all get to visit with, and all these unique settings. And I look forward again to having some of our listeners take my class. If not this headache class, there's a back pain class, and the opportunities for the student day is going to be phenomenal. I love walking through the exhibit hall. That's another reason why I'm looking forward to being there, where I can talk, directly with the manufacturers or the suppliers. I can sample some of their new products. And also, there's a lot of good prizes and raffles. I know I'm giving away some trigger point charts, a whole set of trigger point wall charts there, and then there's plenty of fun. If you like to dance, Club 54 is always fun, and you guys set it up the best with shuttle up and back. It's awesome. You just make it easy. So again, I hope everyone attends. It's going to be a fun and informational conference, and that's really what I look forward to.
Well, I'm with you on all of that. It is a fantastic conference and has something for everyone, lots of educational opportunities. And we'll be talking about your other class in another interview. Today, we're going to be talking about your class on headaches. Now, I've read before, David, that you actually suffered from debilitating headaches and chronic pain for over 20 years, but are actually now pain-free. I'm curious, is that pain what led you to become a massage therapist?
It did, and today, like I said, it's amazing. I suffered for so long. I was told it was genetic. I have a mother that has terrible headaches, a brother who's been disabled by them. I was going down the identical path. And I've been to all the doctors. I've taken the medications. I was sick and tired of being sick and tired, so I know where our patients are coming from when they come into the treatment room. For me, I tried, it was massage, basically trigger point work as an alternative to surgery. My physicians were either mad or dismissive of my suggestions of even integrating massage therapy into, my program. So for me, massage was a major part of my recovery. Of course, I learned a lot about healing myself through the massage profession, a lot about nutrition and exercise and rest and, just good mental state and outlook. But massage was a major part of it, and there were a lot of dysfunctions in my body that had a muscular origin, actually.
Wow. Well, it sounds like you definitely came to the right place, as many of us know and believe that massage therapy can be very effective in treating all kinds of pain and certainly headaches. So I know your class is really going to shed some light on that. Now, right now, I know that you still, before we get into the details of the class, I know that you're still a practicing therapist at your business, the Muscular Pain Relief Center, and have been since 1992. Tell me what you did to stand apart from your competition over the years.
Well, it's a lot of what I needed as when I was a patient. I was a patient just doing my best to try to get well and avoid surgery. And I'm an active practicing therapist, so I understand the realities that all of us face daily, in the treatment room. I realized very quickly out of massage school that I had to set myself apart. For a major part, I was a male in the massage profession over 20 years ago. I mean, it was tough, and people didn't understand. So I realized I had to set myself apart, and one of the ways that I did it is I took some of that medical model and I applied it to massage. The biggest frustration was there were no tools out there that really helped the therapist communicate. So what I do is I spend a lot of time, not a lot of time, I just take a little bit of time and quickly educate my patient about why they experience pain. That is one way that I set myself apart. I do it on multiple levels. One is how I present myself. I do present myself in a professional manner. How we dress and how we act and how we talk does project a certain image. I also have always set myself apart, whether I was doing an outcall or it was right inside of my office. I always presented somewhat of a clinical setting. I would bring trigger point flip charts with me. I would still take even postural photos if I was doing outcalls with somebody, just to help them understand the postural relationships. And then, so taking a little bit of time to educate my patients about posture, how muscles are playing a role in the posture, how those muscles then create pain in their body, whether it's neck pain, headaches, or whatever, how that translates into other areas of their life, and then just trying to set up a program where they could help maintain themselves and they weren't totally reliant on me. They did come to me as needed, but to try to give them the tools for self-care when they weren't there also, so that they would recommend and their friends and family and coworkers to come to me. So those are the different ways that I tried to set myself apart over the years.
Well, they obviously work because you're so successful, and now you're out there teaching therapists on how to do what you do. Are you going to be teaching any of that, those ways to set yourself apart at the Canadian Massage Conference?
Yeah, definitely. That's just part of what I do. Part of what I'm teaching is what I implement in the treatment room. I'm just not out there running around teaching a seminar every weekend. I love teaching, but, I love being in the treatment room. So I want my patients to understand that headaches in this case, typically headaches and neck pain come hand in hand. But those headaches are a symptom, and we want to address or educate them on the soft tissue component of their pain. I'll admit a lot of people will tell you how their headaches, they may have a hormonal component. They're very valid. They may have migraine headaches that are triggered by things that we may not be able to affect from a muscular point of view. But I will share with you a tremendous amount of headaches are of muscular origin, and that's very easily shown to our clients as we assess their tissues and their joints and show them what's under stress. I typically do it with a photograph. A picture's worth 1,000 words, so I real quickly will take a couple postural photos of my client, and I let the picture tell the story. I let them see their forward head posture, their rounded shoulders, their high shoulder, and then I explain to them muscles pulled all these bones into place, and here's where they should be, and because of the position they're in, here's why they're stressed. As we treat them and we find trigger points, we're able to connect the dots from the posture and the pain to their trigger points in their head. And, they're very grateful that now they can see light at the end of their tunnel, because typically by the time they've gotten to a massage therapist, they've tried a lot of other healthcare providers to resolve their pain.
No doubt. I know I suffered from headaches a lot myself and went through all kinds of different sorts of treatment, from acupuncture and drug therapy, drug trials, actually, a number of those.
Oh, really?
Yeah, and massage, I think, and, selling a very large business that I owned, I think helped me more than just about anything else. And, with some of the things that you're mentioning, really, the forward head posture, the rounded shoulders, that sounds like you're talking about really treating the cause of the headache instead of just the symptoms. Do you want to elaborate any more on that?
Yeah, right, and it's getting the patient to understand that. I think that almost all of us have had a patient come in and they tell us how they go to the chiropractor, and the chiropractor showed them on x-rays how their spine's out, how their atlas is out, or their axis is out. Or maybe they went to maybe they went to an orthopedic or some other medical doctor who showed them that they had a bulging disc, and now that's what they're relating all their pain to. But still, we know that even if they have the somewhat of a bulge, in many cases, there's still a very significant muscular component that we could help by just resolving posture. Certain muscles are chronically shortened, certain ones are lengthened, and they become chronically weak. And it's just quickly educating our patients just don't know, like we didn't understand when we first got into massage. It might be very clear to us. When we look at our patients, we instantly see it. That's what we're trained to do. But it's communicating our findings to our patients that I think is important. And, and there again, that's what I talk about heavily throughout classes. How do you communicate your findings? Like, for example, when a patient's on the table and you touch a trigger point in their neck and then it refers in the back of their eyeball or it refers into the side of their head, and they go, oh, I'm just wired wrong, or they make a comment like, oh, I'm all screwed up. I think we've all had our clients say comments like that, and I want to instantly turn around those neurolinguistics. I want them to know they're not wired wrong. They're not all screwed up. This makes total sense. Your postural position has this muscle stressed. This trigger point is well documented, and I like to circle it right on my trigger point charts. If your charts are laminated, I circle my charts with a wet erase marker so I can wipe it off after treatment with a little bit of water on a rag. but I show them the trigger point, and I show them, you are not wired wrong, you are not screwed up, this is a classic trigger point. And that totally undermines their foundation about their headaches. I want to rock their foundation a little bit. I'll agree with them. I may not be able to get rid of your hormone headache. I may not be able to get rid of your migraine headache, but if I could get rid of a majority of your headaches that have a muscular origin, isn't that worth them going for it? And I have to explain and have to have them understand why we can help and how the muscles are involved. And what's happened is the other professions do a great job doing it. I feel that with the new technology that massage therapists have in their hands, we're going to be a powerful force, more with the research, everything that's going on. So with that, one of the ways that I educate people is, again, I'll show them a picture. I'll show them a picture of a trigger point so that they can understand a little bit more of what's going on. So I think the visuals are very important.
Oh, most definitely. I mean, I can think of plenty of times where those kinds of words probably came out of my mouth, especially when dealing with those headaches, because they're so debilitating and frustrating. And I love that you take that as an opportunity to educate and not just let that person keep that mindset that there's something really wrong with them, or that they're made wrong, or they're defective.
Right, and that's so, it's so important, because people, like you've been there, you know what it's like to tell them that the headache's behind your eyeball or in the side of your head. Well, we're going to talk about in class, I'm going to show you the 5 muscles that, Dr. Travell and Simon's research, this is based. These are the 5 muscles you should target if they come in with a frontal headache, or these are the 6 muscles to check for sure for temporal headaches, and here's even the order that you should be checking them based on the research that's out there. Of course, how your client came about receiving that trigger point, could change the order of it. But, I just think it's important that people understand that, right, they're not wired wrong, they're not, they want to be unique, but, I want them to know that there is a soft tissue component to their headache that we can resolve. Some people, part of their label is their headache, and you may not be able to, they may not want all their headaches to be gone, but they will be indebted and grateful to you if you can help the muscular component of it, because it's only going to get worse over time with them. Their posture is going to get worse, their trigger points will get worse, the stress on the joints will get worse. Absolutely.
Well, David, what are some of the main causes of headaches, or causes that you'll be covering in your class and learning to treat?
Well, in my class, like I said, I'll be overgoing things like the posture. I'll be talking about, how to assess and communicate those structural findings, quickly, easily, fast, how to lay out treatment plans. Like, I don't know about you, but I know as my treatment day goes on, I sometimes can't remember, was that the right side, or the left side that they were having the pain on, from the time they walked in till you're treating, or was that the last client or this client? So I'm going to show you little tips on how I keep track of that. I'm also going to show you in class, like, how, as I'm educating the client, I start to lay out a treatment plan for myself based on the research. I'm like doing a few things. Basically, I put my cliff notes, my cheat sheets, whatever you want to call it, I call it the research, the facts, right in front of the client. And I go over with them, real quickly, showing them, I connect posture, I connect their, trigger points for me, and I lay out a plan for myself. But as I'm explaining it to them, I'm getting it very clear in my head what I'm going to do. And you can really do that in just a minute. We all do it anyway. We just typically don't take the time to document and log it and say it verbally once and engage the patient. And I think it's important that we engage the patient.
Most definitely. I think awareness of the problem and the I guess more organic issues that are causing things, as you said, the muscular issues that maybe they can have some impact on in their daily life and not just be coming to you for relief on. It's really important.
Right,
they have to know where it's coming from.
Right, and with that said, then that starts to open the door because they realize you understand and they start asking for other guidance. And that's where you can help guide them properly toward, resources for them to get proper self-care, for exercise, for nutrition, whatever. But they're going to come to you for resources. Maybe it's other things that you sell in your clinic, maybe it's a topical or whatever. But all those are little ways that you can build your practice, and really people look at you as a true healthcare provider when you start to explain and break down why they have the pain and what you're going to do.
Most definitely. Now, does Kent Health Systems offer anything else for therapists, tools or guidance specifically for headaches or just for their practice in general?
Well, yeah, it does. Not so much. It does in many different ways. I have developed a set of trigger point charts. I also have DVD programs. Everything's designed to work on its own. Everything's also designed to work with one another. There's also a range of motion and muscle movement chart. There are posture charts that I developed. And all of these came about because I'm a therapist in the treatment room trying to make it happen, make a living, educate my patients. So they were tools I had to develop because they weren't out there. Were there other trigger point charts? Yes, there definitely were. However, I organized mine different. I put mine in columns, and then I put, like in column 1, all the muscles in the back of the neck. And then in that column, I laid them out. The top muscle is the trapezius, the most superficial muscle. But as you look down the column, it's going superficial to deep. That's exactly how we treat. It's just so easy. I'm tired of looking at charts where I feel like when I was a little kid in the restaurant, you'd get like this little placemat that had like a tree, and you're supposed to find the little, animals in the tree. Can you relate to that question?
Mm-hmm.
And many charts are like that. They're not easy to follow, and I'm I'm kinesthetic, but I'm visual. So yeah, I've tried to make it easy and visual. Things are columns, superficial to deep, everything's color coded. In my DVD programs, I have as much as an hour and 10 minutes of unembalmed dissection. There's over 10 hours of viewing in one of those programs. They're very methodical. They're logical. Everything's, broken down by compartment, by region. And, I just try to make it simple and easy because it's really it's basically everything I had to look up, figure out, and reorganize to make it easy for myself because I have it's challenging to stay focused in the treatment room. You've got to watch your time. You're thinking about your finances. There's so much going on in your head that you're trying to clear out. You've got to be focused on the patient, come up with a treatment plan quickly on whatever they've just thrown at you. So if I'm able to take research and hang that right in front of myself and reference it very methodically during the course of my treatment, it just helps me get good, solid results. So that's what I've tried to create with Kent Health Systems.
I tell you, too, for anybody listening that has not seen David's charts, they are really beautiful and functional, easy to use. I think you have one chart that's like a stand-up chart that you can flip through as you need to get to the certain section. So you can put it close by. It's not something you have to hang on the wall.
And that's even laminated, so you can highlight and circle that.
Yeah, I was really impressed the first time I saw them. And I joke with people about this. I personally have a terrible memory. And, I could look at an email and say, like, let's say it has 2 times on it that I need to remember, like in setting up this interview series, and I look at it and I go to my calendar and I'm like, now what were those times? I mean, I truly can't remember if I don't have it right in front of me. So I think, I can't be the only one out there like that. There's lots of people in our industry and profession that need to have something right there, that they don't, not the book that they run back in between sessions and look at and go, where were those trigger points? What was it that I was supposed to work on first? So I think those are great tools. I definitely encourage people to check those out when they come to Canada, or take a look on your website. But they're really awesome. So, David, I'm curious, I know this is going to be a great class, and it's going to fill up. Last year, your classes were overflowing. So in the event that people can't make it into your class, is there any particular piece of advice that you have with students who are interested in learning to work with clients who suffer from pain and headaches, or in taking this or other workshops?
Yeah, well, one, if you can't, whether you can come to this conference or not, I encourage you to, try to make it happen. I do encourage you to go to my website, kenthealth.com or davidkent.com. Will get you to the same spot, and you can click into articles. And there are close to 50 articles online that you can download, nice printable PDF versions that you can, if you're a therapist, you could utilize them as reference in your clinic. If you're a student, copy them and, print off multiple, take them to class. If you're an instructor, use them, because they talk about everything we've discussed today. They've talked about, it even talks about how to help you find a job if you're a therapist. I've had a clinic for so long. I know what it's like for therapists out there looking, and I know what employers are looking for. I also have articles on posture. I have articles on how to educate your patients using the technology, talking about trigger points, how to assess them quickly. They're all short little articles, so do that. Also click on to watch and listen. Also, if you're a therapist, I think it's important that you're getting body work. I do get regular body work. Outside of my clinic, I get body work from different types of therapists. I think it's important that you experience it and even understand what other therapists are doing. I also feel that as a therapist, it's important if you can take a little time every day for yourself to do just a little bit of yoga and stretch, for self-care, and to connect on what you're telling your patients, because it's one thing to tell them, it's another thing to do it. And the last thing is, if you're able to take my class, be ready to have lots of fun and learn, because it's going to be a great time.
Oh, that's excellent advice. I agree with all of it, especially coming to take your class and getting more massage and body work. We all need to do that. I know that there are some people that didn't catch your website address the first time. So will you just share those websites one more time before we wrap up?
You can go to davidkent.com, K-E-N-T, or kenthealth.com. That's KENTHEALTH.com, kenthealth.com.
Excellent. Thanks for sharing that, David. I want to give people some information about how to come to the conference and register for your class. So, everybody, I want to remind you that the Canadian Massage Conference is Canada's largest exhibition of massage products, continuing education, and new business opportunities for therapists of all disciplines. This year's conference will feature over 50 exhibitors, continuing education classes of 1 hour, 3 hour, and 1 day workshops, including David's Friday and Saturday night receptions, and, as David mentioned, a private dance party at Club 54's Retro Room. I promise that's going to be a blast. And that'll be adjacent to the conference hotel. Now, the registration cost for the conference is just $40, and that happens to include admission to the trade halls and all 1 hour presentations, as well as participation in the raffles and giveaways of literally thousands of dollars in prizes, including the items that David mentioned. You'll also get coffee breaks between classes and loaded goodie bags, which are full of great stuff. Attendees will also have access to many special offers and promotions from the vendors and exhibitors, as well as the chance to have a fantastic time with friends and colleagues. For students, the conference offers a free student day and Smart from the Start program on Sunday, which is sponsored by Massage Warehouse and the Registered Massage Therapists Association of Ontario. This day is dedicated to massage therapy students who are currently enrolled in school or who graduated in 2011, and includes a free gift bag for the first 250 students. Also on Sunday, the RMT Career Fair will be held from 1 to 3 p.m. and is free to all registrants, including students. Now, all of this is happening at the Conference Hotel. That's the Burlington Holiday Inn, and I definitely suggest you make plans to stay there if possible. Single or quad rates are $121 a night, but space is limited, so be sure to make your reservations now. Also, Massage Therapy Canada is printing the Canadian Massage Conference event program inside their magazine. This will be given out at the conference and distributed throughout Canada to over 3,000 registered massage therapists. So if you are a vendor or educator who's listening in today and you want to get some great exposure for your products or classes, please contact Christine Livingstone at Massage Therapy Canada for details on being a part of the conference program. All right, here's the good stuff. Now, if you want to attend the Canadian Massage Conference, November 4th through 6th in Burlington, Ontario, come and meet David and the other amazing presenters at this year's event. There are now 2 ways to do so. First of all, you can register and pick your courses by phone. Your call is free, and operators are waiting to talk to you. So that number is 877-387-9111. That's 877-387-9111. You can also register online at the official conference website, www.canadianmassageconference.com. We also invite you to stay connected with us on Facebook at www.facebook.com/Canadian Massage Conference. Again, the 2001 Canadian Massage Conference is made possible by all of our wonderful sponsors. Thank you so much to the Vitality Depot, Lackner McClelland Insurance, Massage Therapy Canada, Biotone, Massage Warehouse, the Registered Massage Therapist Association of Ontario, and Hand and Stone. I hope after today's broadcast, everyone listening is ready to come to the Canadian Massage Conference and register for the 3-hour class, Headaches, Triggers, and Treatments with David Kent. David, thank you so much for taking the time to be with us today and for sharing your time and knowledge. I'm really looking forward to seeing you in Canada and seeing your class at the Canadian Massage Conference.
Well, Felicia, thank you for having me on the program. I hope everyone registers. I already made my hotel reservations. It's going to be a great time. Please visit my website and watch some of the little video clips where you can learn more about the class and read and download some of those articles that I mentioned. So, again, I'm looking forward to seeing everyone real soon.
Oh, thanks, David. Everybody, this is Felicia Brown, and on behalf of everyone from the Canadian Massage Conference and Massage Therapy Radio, I want to thank you for tuning into this broadcast of the Canadian Massage Conference pre-conference broadcast series. Please remember to tune in each Monday through the beginning of November for more interviews, and to visit massagetherapyradio.com for replays of all the interviews in this series. We really look forward to seeing you in Ontario and hope you will also consider joining us for the American Massage Conference, April 20th through 22nd, 2012 in San Diego, California. Thanks again for tuning in and have a fabulous day.